Hi, I'm Malcom Turnbull. I'm one of the co-chairs of the Reform for Resilience Commission. Never before has the world faced a threat as singular as the Covid-19 pandemic. It is the first time every country, every community has had to deal with the same problem at the same time. So, what about Australia? As you can see from my background, that's where I'm speaking to you from. By all accounts, not that long ago, Australia was ahead of the game. We were largely COVID-free, out of lockdown, and life was pretty much back to normal at the beginning of 2021. But then, when the COVID-19 Delta variant emerged in the middle of the year in Australia, starting at the end of June, the truth became all too apparent. Our federal government had failed to purchase enough vaccines. So most of the heavy lifting in this pandemic has been done by the states and territories. You know, the rule, lockdowns, quarantines, things like that have been handled by them. But the feds had the responsibility of buying vaccines. And the reality was they didn't buy enough. With less than 10% of Australians fully vaccinated at the beginning of July, the government was scrambling to find enough vaccines to inoculate the population. No Moderna had been bought at all, and hardly any Pfizer. Pfizer had sought to do a deal with the Australian government last year in June, but shockingly were effectively fobbed off. Now, the only vaccine available was AstraZeneca, an outstanding vaccine, which we could manufacture in Australia, but even that we did not have enough of. So added to this was the confusing public messaging, and there was experience of this in other parts of the world too, including especially in Europe. And this was over this very remote possibility of blood clots in younger patients. So we got to the point where the government was advising that only adults over the age of 60 should receive AstraZeneca. As the COVID-19 Delta variant progressed and cases rocketed, that was then reversed, and younger people were encouraged to get AstraZeneca. Now, all of this confusion had a huge impact. Older people who were saying, well, if somebody who's 58 shouldn't have AstraZeneca, why should I, who is 65? And of course, younger people were saying, well, last week I was told it wasn't safe for me to have this vaccine, but now I'm told it is. It obviously raises hesitancy and creates an enormous problem. So we did have large numbers hesitant to get the jab. So this was, in my view, the biggest failure of public administration I've ever witnessed in Australia. And so Australians, especially those in Sydney and Melbourne, our two biggest cities, our two biggest states, locked down again from July. And so just as the world was opening up, we were closing down. Now, as a case study, Australia is a striking example of what can go wrong if you rest on your laurels. A lack of planning can have devastating consequences. Huge toll on the health, well-being, livelihoods of individuals, families and communities, and of course, lives lost. Now, Australia is coming out the other end. We have been able to lift our vaccination rates. More Pfizer and indeed Moderna were obtained. And right now, just as I'm speaking to you, more than 70% of people over the age of 16 are fully vaccinated, and over 85% have had at least one dose. And in New South Wales, our largest state, the numbers are even higher than that. So we're coming out of lockdown. But we cannot become complacent again and lose momentum. We need to learn the lessons of this pandemic and use it as a catalyst for serious reform. Now, that's really what the Reform for Resilience Commission is all about. You know, the object of this is to learn what has happened around the world, recognise the successes and the failures, There's no point, we don't have to be judgmental, there's plenty of people that will do that, but learn from this to make sure that we are more resilient in the future. Now, the Commission has released an interim report based on months of study and research, all of which has pointed to the systemic weaknesses in both global and national health and economic resilience. One of the Commission's most urgent recommendations is the need to prioritise the global distribution of COVID-19 vaccines. Now, we only need to look to our friends in Southeast Asia, where the vaccine rollout has been slow and uneven. Now, there has been rapid improvement in a number of countries. Obviously, Singapore has done very well with very high vaccination rates. But then on the other hand, if you look at Hong Kong, which has got a lot of similarities to Singapore, you've got a much lower vaccination rate despite plenty of vaccines being available. So, comparing the issues about hesitancy in Singapore and Hong Kong is enormously helpful and enlightening. Take Malaysia. The fully vaccinated rate now stands at more than 70%. The average number of new infections reported each day has fallen by more than 6,300 in the last 3 weeks. Now, that's great news. But for many other Southeast Asian nations, daily cases continue to rise and vaccination rates remain low. If you look at Asia as a whole, about 40% of the population is vaccinated, and that's well below Europe and North America, which is currently sitting at well over 50%. Now, recently, the Asian Development Bank lowered its 2021 growth outlook for the region because of the recurring spikes in COVID-19 cases and the resulting lockdowns and economic containment. And with Southeast Asia a critical part of the global manufacturing supply chain, what happens in this part of the world invariably affects the whole world. I mean, in this region, we often talk about the centrality of ASEAN, the Association of Southeast Asian Nations. But really, globally, we need to recognise the centrality of the Asia Pacific. It is the biggest economic driver in the world today. And so as the Asia Pacific goes, so goes the rest of the world, and hence the importance of this discussion today, and of course the importance of the work that is being done in the Asia Pacific hub from Taipei. And I want to give my thanks and respect to all those involved in that, and in particular my very good friend Shirley Lin. Now, even for a country like Malaysia that has reached the more than 70% fully vaccinated milestone, it's still widely deemed as high risk in the region. Malaysians have been excluded from entering Singapore, which is literally just right next door. Now, another reminder that the world is yet to return to pre-pandemic levels of tourism, trade and economic exchange. As the Commission has stated in its report, it's a truism. You might say it's a penetrating glimpse of the obvious, but if we're not careful, it will be nonetheless overlooked. And that's this: no country is safe until every country is safe. COVID-19 is here to stay, at least in the foreseeable future. And that means we have to do the work now to make sure we live safely, freely and productively, even while the virus roams among us. That means a serious structural commitment to rebuilding economic health and social systems that are resilient, fair, equitable, and environmentally sustainable. Now, take the example of Africa. The total number of recorded deaths in the entire African continent, for example, is slightly less than those recorded in the UK. And even if underreporting is accounted for, Africa's mortality rate is still lower than in Western Europe. And even though Africa has some of the world's lowest vaccination rates at around 5%, it's contained the pandemic largely in part to its previous experience of managing epidemics, including Ebola in 2014-15, and the foundations of community-oriented healthcare systems. Now, what this highlights is that vulnerability and a lack of preparedness are not the same thing. And this is seen right across the globe, with often the more developed countries hit harder by the pandemic. One only has to look at the United States, which stumbled badly in the early days of the pandemic under President Trump, and which currently sits at more than 45 million cases and 730,000 deaths. And in the United States, of course, vaccine availability is not the issue. The big problem is vaccine hesitancy and the pandemic of misinformation. You know, this is just as important. The spread of misinformation, lies, bluntly. So resilience is the key. It's the key to our success now and in the future. We must take the time and invest in a world that will be prepared for future pandemics. It's dangerous to assume that pandemics are rare, that they're a 1 in 100-year event. As we've seen, a virus can travel at the speed of a jet aeroplane. And so a multilateral approach is needed more than ever before. And we have the tools to do that because we actually know what's going on in real time all around the world. Well, here, as I said at the outset, we're dealing with the same problems at the same time, literally in real time. And that means there is just so much to learn. So we mustn't be defensive, we mustn't be judgmental. The approach to this has got to be no blame, no shame, learn from everywhere and make sure that we bring that corpus of knowledge together so that we can build the resilience for the next pandemic and indeed ensure that our health, physical health, mental health, economic health is more resilient in the months and years ahead. Now, this will require leadership, the scarcest natural resource, and it requires boldness from leaders from different worlds, from government, from business and health. Break down the silos, come together and collaborate. And that's what this commission is all about. So we can't return to the old days. Time has moved on. The virus has transformed our perspective on public health around the world. Today is the time to rebuild and embed the health resilience we need for the future. Thank you very much.